Thumb joint replacement or arthroplasty is a very common condition and a commonly performed operation, particularly because thumb joint arthritis is extremely common in the population, particularly in females, where the risk is 11 times that of males. It is reckoned that approximately a quarter of the population at any one time will have significant thumb joint arthritis, which shows how common it is. Of course, there are a variety of conservative treatments, including splintage, hand therapy, non-steroidal anti-inflammatory medication, and injections, and other lesser surgical procedures such as denervation of the thumb and arthroscopy of the thumb and debridement. However, it is very common to require surgical treatment, and this takes really two forms. One is to take away or fuse the joint. This has the advantage of abolishing pain, but may result in complications such as limitation of movement, or sometimes that the thumb collapses under load. Therefore, my preferred treatment is to perform thumb joint replacement. I perform two different forms of thumb joint replacement depending upon the nature of the condition, the age of the patient, and their demands. For younger patients, I tend to use a pyrocarbon implant, and effectively what this does is it forms a spacer between the joint. Pyrocarbon is a superheated form of carbon which is very tough and durable, very like bone in its physical characteristics, but also very slippery, so that once the arthritis is removed, it forms the new joint surface. The other form of joint replacement that I use is known as the Motec CMC joint replacement, and this consists of a ball and socket joint with a screw that goes down into the metacarpal, that's the long bone of the thumb, and a screw that also goes into the trapezium, and they're connected together by a ball and socket joint. Which form of joint replacement used depends upon both the nature of the bones, and they vary considerably amongst individuals, and the demands of the patient. In either case, the procedure is generally performed as a day case, and the patient is in plaster for a period of approximately 2 weeks. Following this, they may require a short period of splintage following this, but the aim then is to get the thumb moving as quickly as possible. Full recovery does take up to 3 months. It has the complications of all joint replacement, such as infection, dislocation and early loosening, and overall the success rate of thumb joint replacement is around 92 or 93%. Thank you.